If you have inflammation in your mouth and you have 7 of these pathogens, those pathogens are going to end up in the superhighway of the body because they work its way through the epithelium in the mouth. It's called leaky gums.
What are the day-to-day habits that we should be doing to be able to foster the appropriate microbiome in our mouth?
The plaque that forms over time has to be effectively and efficiently removed.
Any preference on toothpaste?
So you want to stay away from anything that creates allergies, which is the sodium lauryl sulfates, the SLS. You also have certain of these sugar substitutes are not so healthy.
The biggest shift needs to be the relationship that consumers have with the healthcare system. I think it's been so tarnished.
My goal, I tell everybody, we're doing opposite that everybody's doing because that's what we have to disrupt.
I'm your host, Chloe Harrouche, and this is Get Well Better. I am thrilled to welcome Dr. Jonathan Levine. A little background is Dr. Levine is a very, very well-respected prosthodontist on the Upper East Side, impossible to get an appointment with, but he just opened a new awesome practice in Tribeca that takes prosthodontics, but also dentistry, orthodont, everything to another level. You can really think about it as longevity for your mouth, oral health, talking about the microbiome. I mean, we're going to talk about it all. But when I went, I was blown away by just how much you can learn at your practice. And I had never even thought about finding this information out about myself. And so I wanted to bring you on because I think it's so important for people to be thinking about oral health differently. I know people today dread going to the dentist for their 6-month cleaning. I would say probably most people don't follow that cadence and they should. And so I want people to understand why that's so important. But sort of more importantly, what are some of these diagnostics that we should be digging into? Why? So I wanted you to help educate us on that and obviously tell us about Smile House. So before we do that, let's take a step back and learn a little bit about your background. Like, how did you get to where you are today? How did you become this very celebrated surgeon, doctor, however you want to describe yourself? Because I feel like you're a little bit of everything. And by the way, serial entrepreneur.
So taking it from the beginning, I started off as an athlete in college, a lacrosse player of all things, growing sport today. But I learned something really interesting, which is when you dream big and you do it with people you love. That's when the magic happens. So we had this amazing coach, had amazing guys that we grew together over the 3-4 years. And we won a national championship my senior year. We were undefeated. And that took me forward when I decided, well, I don't like hospitals. I didn't think I liked business because my dad was in this crazy fur business that there was always like arguments around the dinner table. So I took that to mean, well, I'm not going to like that. And then I said, I was doing some sculpture and worked with my hands, in the art side. And I loved healthcare. And I was a science guy. I was in microbiology, immunology major. I'm going to go into dentistry. Well, little did I know that when I got out of an amazing dental school, BU, Boston University Goldman School, which was really a specialty dental school. So it graduated orthodontist, periodontist, prosthodontist, endodontist, along with the pre-doctoral class. And most of the docs coming out of that, 37 people in the class, go on either to get, we would get a DMD degree, but they get an MD, and everybody specializes. I ended up specializing, and I end up meeting this technician who literally invented how to bond porcelain to teeth, which is the porcelain veneer technique. I'm all of 26 years old. Okay. So here I am in an industry that completely needs disruption. It is a solo sport. There's no collaboration. It's fragmented. It's the ma and pa industry at its finest. And here I am, a guy who thinks life is a team sport. We're going to reinvent this thing. And that was 3.5 decades ago. And that's what I've done since then. I've run a program. I've started a few companies. I've always built my team as a team. And my idea was, let's put all the specialists. I'm prosthodontist, we're very involved with the structure, the function, the biology, and of course the aesthetics that goes hand in hand. And that combination, instead of referring out to another specialist and you would be waiting for an answer and their team wasn't as patient-focused and hospitality-focused that I wanted to do, I said, I'm bringing them all under one roof. And when I did that, everything changed because the communication changed, the collaboration changed, where you start looking at the diagnostics with the point of view of multiple specialists. So you mentioned orthodontist, you're moving teeth. We work from a design, like an architect. So even 30 years ago, we would wax it up like they do jewelry. They do a lost wax technique. Now we do everything digitally off the face on softwares called ExoCAD. 3D print that, can mock that up in the mouth, show a patient what they look like, look at the design, videotape that patient. There's all kind of neat things that we do now in this digital workflow, but together, the old story is so much better. Friday mornings, we put our patient data up on the screen. All the specialists are on. I don't care if somebody's lecturing in Singapore. We're all on at that time, and we collaborate and we come up with a care plan based on the needs of the patient. That's the most conservative way to get there. And you learn so much together. We call it mouth mapping. So mouth mapping towards dental longevity, because we believe that oral health leads to overall health. Why do we believe that? There's literally 20 years of good science and research that shows the connection between inflammation in the mouth to these inflammatory diseases of the body, which is every one you could name, the 54 of them. Mm-hmm. So, for example, over COVID, if you had periodontal disease, which is a chronic inflammation in the mouth, you were 4.5 times more likely to end up on a ventilator. You are 3 times more likely to have erectile dysfunction if you have periodontal disease. You take care of periodontal disease, your inflammatory markers and your cardiovascular disease gets better, on, and diabetes. And so this whole notion of getting the mouth healthy, but also getting ahead of these chronic inflammatory diseases, will get us upstream to more of a wellness model, which is why people need to understand why it's so important to have the right habits and really take care of their mouth from a standpoint of all the things that go to longevity. It's very interesting that, well, for overall health, longevity, sleep, of course, nutrition, fitness, and how we deal with stress, those 4 pillars line up to overall longevity. Well, the same pillars line up for dentistry and, of course, the oral health. And it's quite incredible. You know, it all ties in together. So I started, kind of on a college experience that led me down this crazy road of like, let's keep reinventing, let's reimagining. And when you hang out with business people and academics, like, it's kind of interesting because you get both sides of that.
Yeah, I mean, it's very rare to find a doctor who is so entrepreneurial. And I was telling you this before, like, I feel like with every decade that you've been in practice, like, there's probably been 3 to 5 innovations that you've come up with, which is pretty wild and very rare because doctors are notoriously bad at business. Anyway, so when you think about JBL and like that practice, what do you think you were best known for? Like the mouth mapping concept, was that present as part of your JBL practice, or did you get on the map with another procedure? Or like, what was your reputation there?
Yeah. My reputation when I first came out of the block, so to speak, was for aesthetics. And I was one of the first guys in the country to do porcelain veneers because I met this fantastic technician named Adrian Jerem, who's blessed memory. And he figured out with a guy named John Gwinnett in Stony Brook how to etch porcelain and bond it to the teeth. This is the early 80s. This didn't become a little bit mainstream to the mid 90s. And I was lecturing all over the world with a group of us from NYU, and it was really a lot of fun, but we were bringing a new technology. So I was known for aesthetics. I ended up, after 4 or 5 years of working hard with this porcelain veneer and aesthetics, went back to school. My wife was pregnant with our first son, Julian, and I was working 3 nights a week and a Saturday, and I must have weighed about 160 pounds, and I was probably happier than I've ever been because, it's just like, let's go do it. I mean, that's kind of what, I always learned in my earlier days. And we went after it. And I came out of that program and opened up a practice, which is JBL 923 5th and 73rd, with the mindset of a specialist as a prosthodontist. And a prosthodontist looks at things that way. So great people before me, a Pete Dawson, a Frank Spear, who was actually about my age, but the folks that really figured out these domains of aesthetics, but looking at these other diagnostics of structure, function, and biology. But the way we coordinate it now, because of our digital technology, because of our comp science, because of our understanding, and I have to give my son Cody credit, who's a branding marketing, I call him a genius at this. He came up with this concept of mouth mapping, of mapping the mouth in a way that we learned over a couple of decades, which is to look at those 4 domains, but now the technology of CAT scans for your jaws, where you see everything from the top of the nose to the throat. We diagnosed airway, sinus problems, joint problems.
I want to break that down because I thought it was wild how when I came in, you sort of broke it down into all the different tests that you could possibly do to be able to get a full comprehensive assessment of my airways, the microbiome, cancer screening. Obviously, none of that is what you look at when you go to a typical dentist, right? Like most of us go to the dentist, I said, maybe once every 6 months, we get our cleaning, we do a few x-rays, which are miserable, and we hate going to the dentist. And I feel like what you're trying to do is completely expand the sort of scope of what you can learn from the mouth. So can you actually break down what those 4 pillars are? Because I don't know if you actually defined them. And what are the diagnostics that you include to be able to assess that pillar? And then we can talk about also just like general habits to be able to optimize those specific habits that people can leave today with.
Absolutely. So four pillars, We say it so many times, it just rolls off the tongue, but it's aesthetics and then structure. So imagine your jaws, your upper and lower jaw, and how that is positioned in the shape. And that has a lot to do with growth and development and also the environment. I'll explain what that's all about. And then function, how they come together, and then biology. So imagine that in growth and development, depending on how you breathe, mouth breathing or nasal breathing, how you chew hard food or soft food, how you breastfeed or bottle feed will help determine your jaw size. It's kind of interesting, right? So 400 years ago, from all the different studies, they didn't need wisdom teeth taken out and all this orthodontics. They look at the skulls of 400 or 500 years ago. So what has happened today? And what has happened is the modern world has taken place and the modern diet has taken place. So we've learned a lot. There's some great scientists out of UCLA who have found this out, a great book called Jaws from an orthodontist, Sandra Kahn, and a book called Jaws by Paul Ehrlich. But we basically embody this concept of these 4 domains. Now, the technology allows us to do things digitally and to do it very efficiently. So we were talking about Pronovo, and we look at these companies that now, because of comp science and digital workflow, we could really look at full body CAT scans in fairly short order. It's the same thing. So now we have a CAT scan. It's called the CBCT in dentistry. You went through it, and you can see graphically, what does my sinus look like? Do I have an obstruction? What's my airway like? Do I have an obstruction? What's the size of it? If it's less than 120, 110, a patient I just left, and it's 32, 33 cubic centimeters, well, you know what? You're breathing through a straw. You got to be breathing through a big fire hose. So how are we going to change that? There's ways to change it. We look in the throat. We look at the palatal tissues. So we look at things with aesthetics. If on intake, aesthetics is important, and we're seeing aesthetic issues. And we always look at things from the face. So what do? We think about smile design. We can design the smile, where we want to put the teeth, how we might change volume of the teeth in relationship to the face. So, for instance, without giving you too much detail on this, from 30 to 60, the upper lip drops 1 millimeter every decade. So at 30 years old, you show 3 millimeters of your upper anterior teeth in a healthy, beautiful smile. At 60, you show 1.5 millimeters on the lower teeth. Means you are now, the lips are hiding and everything drops. Now, see what you have to look forward to? So what happens? This soft tissue loses some of the bone structure, the elastin, the collagen of the skin, and it drops down. So we want to diagnose that because there's things we can do that kind of put the parts back together again.
Yeah.
I don't want to bore you with that. So we look at aesthetics. Structure, we're looking at the CBCT. Function, we look at itero scans, which is intraoral scans, which we need also to create the smile design. And we look at function from a clinical analysis. And then biology is all of the things you experience with doing, oral cancer examination, of course, periodontal probing, make sure the tissue is healthy, pH testing, and salivary diagnostics tells us what is that microbiome. Why is that important? The microbiome seeds the gut. What does that mean? Well, if you have inflammation in your mouth and you have 7 of these pathogens, those pathogens are going to end up in the superhighway of the body because they work its way through the epithelium in the mouth. It's called leaky gums. So who's talking about leaky gums? Not too many people, but I am, because
but everyone's talking about leaky gut.
But you're talking about, and the leaky gut-brain axis, and we know that those contents of the gut, which is such loaded with toxins and inflammatory type antigenic bacteria, all over, gets into the body, gets into the brain. Well, we find P. gingivalis, which is the pathogen of the mouth, in the amyloid plaque of the brain for Alzheimer's, in the carotid artery of coronary artery disease, in the interstitial cells of leaky gut. What is P. gingivalis doing in the gut? Because the mouth sees the gut. Okay, so I make a good argument that
we should care.
We should care, and you got to get yourself into a dental practice that is learning to look at things and using this technology, but looking things in a way as a holistic, integrative approach where medicine is going. That is within the medicine is going today, as you know. You represent this. Well, medicine needs to also connect with dentistry. I like to call it transdisciplinary, but it's basically an integrative approach for the ecosystem called the body.
This episode of Get Well Better is brought to you by Smile House, founded by Dr. Jonathan Levine, America's most trusted expert in oral health and dental longevity. Say goodbye to dreading the dentist. Smile House is New York City's revolutionary wellness destination, where expert dental and functional health specialists work together to optimize your oral health. Because a healthy mouth is the gateway to lowering inflammation, balancing hormones, supporting the microbiome, preventing chronic disease, and living a longer, happier life. Get $100 off your first treatment at Smile House by booking online at smilehouse.co and mentioning the Lambie podcast or Chloe Harrouche. Not in New York City? Not a problem. You can optimize your oral health in just 4 minutes a day, right from home. Simply DM guide to Smilehouse Tribeca on Instagram to receive Dr. Levine's free comprehensive oral wellness home care guide, your step-by-step blueprint to a healthier mouth and a healthier you. Because lifelong health starts with your smile. So again, going back to the 6-month dental cleaning, is that enough to be able to foster a healthy microbiome? Tell us a little bit about what are the tactical day-to-day habits that we should be doing to be able to foster the appropriate microbiome in our mouths.
Perfect. And I'll say that you got to get baselined, just like somebody goes to your facility, they have to get a baseline. Based on that baseline, you can create a care plan. From the care plan, you get them to a healthy level. But the microfilm, the biofilm on the teeth, the plaque that forms over time has to be effectively and efficiently removed. And it has to be done mechanically, not chemically, because chemicals will throw off your microbiome. Mm-hmm. Imagine you have an antibiotic rinse. It completely creates dysbiosis because you're now throwing off that beautiful homeostatic balance that we have in our body. The mouth is the second biggest microbiome. Gut being the biggest with 8 trillion. The mouth is 7 billion with 600 species. Okay, now you know that. You can say, okay, what do I got to do? So electric brushes are 5 times more effective than manual brushes. But if you're really good with manual brushes and you understand this modified bass technique and it's like a backhand in tennis, you got to get really good at it.
Electric brushes are cheap. We should all just have an electric brush.
We should all have an electric brush. You just got to remember to change the head every 45 days because it does.
Oh, that I don't do.
It does pick up bacteria.
I need to do that.
But we're in the bathroom and you can imagine what happens. So you gotta change the heads for sure. But electric brush, you got to think about this. This is twice a day. We say we brush for 2 minutes, 30 seconds a quadrant. I've been on Dr. Oz and CBS and all this stuff talking about plaque control. But basically, electric brush, I love these new water flossers. I love them because it flushes between the teeth. It's easy to use. You feel so nice and healthy. So I like electric brush. I like a water flosser. I love a tongue scraper.
So not the traditional floss. You want a water flosser.
Well, I go both.
Okay.
I do go both. And
Or you buy a water flosser on Amazon?
yeah.
Okay.
When you come to us, we have our own also.
Okay.
You need 60 PSI, so it's got to be powerful.
Any preference on toothpaste?
Well, of course I have a preference on toothpaste because, toothpaste is not all toothpaste are created equal. Sorry about that, but it's true. So you want to stay away from anything that creates allergies, which is the sodium lauryl sulfates, the SLS, causes aphthous ulcers. You also have certain of these sugar substitutes are not so healthy. So I am completely biased because I like the Twice toothpaste because they have vitamins, antioxidants. They don't have sodium lauryl sulfate. And truth be told, Dad had to help out a little bit with the formulation because I've been building toothpaste
So
for
Twice,
20 years.
by the way, is his son's toothpaste brand.
Yes.
Where do you buy that?
You can buy it at Walmart and at smiletwice.com.
Not on Amazon?
And Amazon.
Okay, great.
Yes.
So Twice toothpaste.
Twice toothpaste. Water flossers, you could use Oral-B. You could come visit us at Smile House. We have them there, 60 PSIs. The beauty of the 60 PSIs, if your significant other is close by and next to you, you can have into a great water fight. This thing really goes. So you got to remember that. Then
Last thing I want to do when I'm trying to get ready for bed is have a water fight.
Oh, it's the best. It's the best. You can use the regular floss right after the water flosser because what the water flosser does is it gets between the teeth and gets any of the debris out. The electric brush is great, but the problem is it doesn't get between the teeth. So between the teeth is where you get inflammation, the periodontal disease, and also where you get bad breath. Bad breath from between the teeth. And also on the tongue, on the recesses of the tongue.
Do you believe in tongue scraping?
I love tongue scraping.
Okay.
Big fan.
Every day? Twice a day?
If you're a little bit of a maniac, twice a day. But for sure, when you're waking up in the morning, and what you'll see that white coating. That's kind of the bacterial population because it lives in our mouth in a very diversified.
But it's good to be getting rid of that, you're saying.
You want to take that film off. And what I like to do is the boys, my sons, I call them the boys, my sons have a fantastic rinse because it has low level of an oxygenating agent and also it has sodium bicarbonate. The key in the mouth for health is pH. Mm-hmm. The acid-base balance, you want it about 7.
Yeah.
So they have a rinse that takes you way up to 8.4 that really does a good job because we all have, low acid, coffee, all these kind of drinks. So and also all the foods, all the meats and the fishes, all the proteins are acidifying foods. So you want to kind of balance your diet with alkalinizing, like what Mom always told us, eat our vegetables and the fruits. So alkalinizing diet, of course, is going to raise the pH, but I like their rinse a lot. And then I like the tongue scraper to finish and then rinse out. The flossing will happen right after the water flosser. So let me take it from the top. Electric brush, water flosser. Then I like regular floss, and I like floss on floss picks when people have trouble kind of doing the manual dexterity need on regular floss. And then I like tongue scraping and then finish it off with the immunity rinse from Twice. Any kind of rinse that does not have alcohol, that could have a low level of fluoride, great also is for a rinse, any rinse, but no alcohol in the rinse, which dries out the mouth.
Okay. Let's talk about alcohol, coffee, whether it's wine or clear alcohol.
Yeah.
How much does that affect like the teeth whitening, even the gut microbiome in the mouth?
Yeah.
Like, are those things that we should be avoiding?
Yeah.
I mean, obviously we should avoid alcohol for longevity, but specifically as it relates to the mouth, what's going on?
It's the old rules apply. What impacts the body impacts the mouth and vice versa because the mouth is part of the body and we live in one ecosystem called our body. So the enemy in the mouth is two things, is sugar, and unfortunately it is alcohol because alcohol lowers the pH. Now, why is lowering the pH, I just said before, so bad is that it can help create this lower pH. Below 5.4, you start demineralizing teeth. So the enamel starts wearing. So people have wear on their teeth. Where'd that come from? You take their pH and it's like 5.2, 5.4. So we immediately are in our own office. We're teaching people how to get that pH back to 7. So pH is uber important. When you have your drinks, your flossing, your water flosser, all those things will raise up the pH and get you to that healthy microbiome.
Coffee? Alcohol?
So coffee's acidic. Alcohol lowers the pH. And
coffee's actually good.
Well, coffee is good, but
you have to just drink it with a straw.
No, you can't drink coffee with a straw. It kills the
I
taste.
agree.
And so it's moderation. Coffee, look, you got some antioxidants in coffee that works well. It's moderation. It's not getting yourself jazzed up, hyped up, and have 3-4 cups a day. That goes back to sleep. You got to get sleep. And sugar, let's say we all have
Sugar's the
a
worst.
we have a little bit of a sweet tooth. You know what? A little bit, moderation, an hour and a half to 2 hours before you go to sleep. After you have dinner, take a good 10 to 15-minute walk. Start burning that sugar off. So you want to kind of keep that blood glucose level at a normal amount. Because what does happen in this country is we're dealing with an obesity epidemic.
For sure.
And a diabetic epidemic. So we really got to think about one of the most important things. I mean, I always say fitness is the most important. I work out every day for 35 years, and I'm a bit of a maniac. All my friends know me. I'm a cyclist. But what happens is if we fall off the wagon and have a little extra dessert, at least we're burning it. You know what I'm saying?
100%.
And so nutrition, fitness, stress management, sleep, when we put those things together, our bodies are going to work at a much higher level.
So assuming you're doing all of those lifestyle things, like you're eating well,
Right.
you're exercising, you're drinking a lot of water, you're maybe also drinking trace minerals, electrolytes, you have a good, healthy regimen. Should you be worried about your microbiome? Like, are you less likely to get mouth cancer? Like, how much does the mouth, what happens in the mouth, affected by what you eat? Obviously the sugar component, but like all of the vegetables. I mean, I guess we talked about the pH, but is there anything that like is just completely out of our control?
Yes. It's called host response. It's how we're built. So there's a genetic component. There's all those things that we talked about, longevity. And there's this thing called environment.
Mm-hmm.
Environmental toxins and heavy metals. We can go into heavy metals. And we think we're eating so healthy, but we're having salmon from the Atlantic Ocean, which is loaded with mercury. And so you get a heavy metals test, and you got a mercury problem. You might have some amalgams in your mouth, which are completely toxic. And unfortunately, from the latest science, I was never like this up until 5 years ago, you got to get these old amalgams out of your mouth. Because on chewing, there's a mercury vapor that is given off. And so that's for sure. It's been banned in Scandinavia. 25 years, Europe just banned it a few years ago because of these recent studies. But so we have to think about our host response, how we respond to foreign invaders. Think about how everybody had a different response over COVID,
Right.
depending on the level of health you were at and whether you had some baseline chronic inflammatory disease. Did you have diabetes? Did you have OCD? Or did you have a cognitive function issue, Alzheimer's? Any of these things got exacerbated by an overwhelmed immune response as soon as COVID hit, and the virus hit. So, you think about it, we're all wired differently. So you really want to have these healthy habits, right? They're like high performance habits to be healthy, but we just have to be conscious of all these diagnostic opportunities we have to have access to care. And for people who have access to care, you got to take advantage of it.
So in other words, the oral microbiome and generally what's happening in our mouths, whether it's looking at the pH, is really a microcosm of the health of our entire bodies.
You could absolutely say that. And the importance of the second biggest microbiome is obvious. The gut is critically important. The mouth is critically important. And it all has to do with paying attention and our intentionality of focusing on our health and not taking it for granted. And what happens with young people is they don't really go to the doctors like they should.
Right.
And so people go to the dental office more than they go to their doctors. So if we can get upstream and we can have a wellness approach, and I'm working with a group of people in the country, I'm very excited about it, and we're going to roll it out probably in about 6 months, where in a dental office, we could baseline medical so that we can work with our medical colleagues. We call it dental medical integration, DMI.
Why are we not working together on this?
This is why I'm here. I'm talking to you about it. But it's just through a finger prick, we could get a basic blood panel and with 40 markers, and we can understand the A1C, we can understand inflammatory markers, IL-6, C-reactive protein, on and on and on, lipids. And we can now share this information with our medical colleagues. And we can connect the dots because that's what I want to do. And this is why I have a podcast called Think Oral Health, and I got a new book coming out all about the connection of the mouth and the body, because people got to know how important it is.
And not to mention the relationship between the mouth and the brain, which you did touch on with the Alzheimer's.
Just touched it. Yep.
But there is also, when it comes to depression, anxiety, can you explain a little bit? Because people, I think, know about the gut-brain connection. I would imagine it's similar, given that it's sort of tied to the microbiome. But to what extent is there a similar connection between the mouth and the brain?
So the basics is every disease is inflammatory, whether it's cancer, whether it's cognitive function, whether it's diabetes, whether it's cardiovascular disease, whether it's periodontal disease. It's inflammatory. So if we have an inflammatory process going on in the mouth, the endotoxins of the bacteria, and there's 7 pathogens, the leading one is called P. gingivalis, PG. Those endotoxins works its way into the superhighway called our blood system, our circulatory system. Now, pathogens go through the blood system and also through the gut. You can think of the triangulation that happens between the mouth, leaky gums, to the gut, then leaky gut, then to the brain. So what is that bug that ends up in the gut, that ends up in the amyloid doing? It's causing inflammation. And these small little vessels that are getting blocked and all these problems with cognitive function and Alzheimer's, that's the start of. If we control inflammation in our body at an early age and don't allow these chronic inflammatory diseases to happen, we're healthier. Our system of this country, which is 20% of our GDP, goes towards healthcare. What does that mean? That's close to $4 trillion.
Yeah.
I mean, so you could save billions and billions of dollars. And, all the functional medicine people are talking about this, right? For the last 10 years. Andrew Human and Mark Hyman and all these wonderful people that are really taking this Western medicine approach and waking them up. They need to be woken up, just like dentistry needs to be woken up. We need to work together better. And we need to understand that the body is an ecosystem, that even though we're siloed for a reason, because we have our science about GI and cardiology and, neurology, we have that.
No one's thinking about it from the
we got to think of it integrative with all of us together. And we can get upstream and we can save the system billions, but of course we can make people healthier.
Yeah. And I think the biggest shift needs to be the relationship that consumers have with the healthcare system. I think it's been so tarnished by Western medicine, by insurance, by all of the sort of noise of healthcare, that people just have this perception that going to the doctor is, one, a waste of time, and something they can sort of circumvent by, doing just almost like bootstrapping their own wellness strategy. And I think the problem is that people just don't know their own data, and they go to a lot of places that have off-the-shelf, direct-to-consumer type of diagnostics, which are not, clinically backed by, an actual physician who's overseeing the results and helping you implement them. And that's where things can get tricky. And so the fact that you're having all of this stuff within your practice, I think is great, because it's not just about getting the data. It's about creating the whole experience around having a trusted relationship with a provider who can interpret that data and help you implement, the recommendations that come from it.
Exactly. It's got to be actionable. So we learn. We want that patient journey to be one that excites and delights, right? And we call it unreasonable hospitality.
Exactly.
My goal, I tell everybody, we're making dentistry cool. We're doing the rule of opposites. We're doing opposite that everybody's doing, because that's what we have to disrupt. What you're doing is you're disrupting in what you do. You're making it accessible for people to understand their health. And then we want it to be actionable so they can take action. And a lot of it is so preventable just by understanding and becoming knowledgeable and doing all these little things. Exactly. I always say, if you come in regularly and don't show up, versus not showing up in 3 to 4 years to the hygienist, you're going to have some problems. There's going to be demineralization, there's going to be decay, you're going to have all these issues. But how about if you come in timely and we baseline you and we get you healthy, and maybe you just needed a couple little tweaks, you needed to move some teeth into better position so function was better. But if the dentistry profession understood the connection of the mouth and the body better, because that has to be picked up in education, it needs to exist more in dental school. Medical school, do you know you still have medical school? Only 50% of the medical school teaches nutrition today.
Oh, of course I know. That's why we have a whole care team model similar to you. The similarities between our practices is wild, but it makes sense. I think at the end of the day, you need to have multiple specialties in order to create the type of experience and value and scope that allows people to really move the needle. You can't have a doctor operating in a vacuum. You need to layer in wellness and how we do that. We can't expect all doctors to get trained on nutrition. Of course, they should respect the importance of food as medicine, but when it comes to actually implementing those recommendations,
you need the experts.
that's the what we call a wellness advisor, which is a
good.
Registered dietitian.
So good.
Yeah.
So good. Yeah, I'm with you. I have two of my hygienists are nutritionists.
Amazing.
I mean, you got to talk to people about what they're eating, what they're putting in their mouth.
100%. And it does have to be personalized too.
Yes.
Like you can't just be eating the same thing that the person next to you is eating. Their microbiome may be different, but also
we can find out.
Their pH may be different. Their baseline may be different. I think it's so important to know your baseline. You're absolutely right. One last question, which because I feel like we didn't touch on, is teeth whitening.
I know a little bit about that.
I'm sure you do.
Yeah.
Everyone wants to have whiter teeth.
Yeah.
Is there a magic trick, or does everyone just need to buy Crest white strips, or does everyone need to like go to an actual prosthodontist?
Yeah.
To do that.
Yeah, no, you got to understand the science and the anatomy of the tooth structure. But basically, there's two forms of the tooth that gets them darker. You can get genetically predisposed to yellowish teeth, right? And that's in the below the enamel surface in the dentin. And there are these color pigments called chromophores. Then you can have stainy food like coffee, red wine, tea, and then you can get this extrinsic stain. Okay. So over the last 20 years, started two companies that have about 29 patents now on teeth whitening devices and formulations. So I like to live in that world too. The fact of the matter is what you want to do is you want to have contact time of the active, which is an oxygenating agent. And the best one is hydrogen peroxide. But you want to do it with frequency and not a high concentration. And it has to be in a formulation that stays on the teeth. So Crest White Strips is a wonderful product when it first came out and still is. It can irritate the gums a little bit, but nothing's going to replace in-office teeth whitening in the dental practice. That's just the truth because we can isolate everything. We can protect the gums. You can have 3 or 4 of these 8-minute applications. And the big invention that we did in 2008 till now, with our Glow Science company is to develop a device that closes the system but warms the gel so you get greater oxygen release so it's very fast. And it doesn't bathe the tissues like the tray and gel.
How long does it take?
Yeah, so there basically takes 8-minute applications and we call them passes. And if you had a whitening, it's either 3 or 4 of these passes. So literally in an hour and a half in our offices, you can have a cleaning and a whitening. And then when you have another cleaning, you do a touch-up for about 6-7 minutes. And
how long after you do a whitening do you have to avoid all the bad things like the coffee and the wine? You want to do a straw, go do a straw for 24 to 48 hours. I mean, I'm a coffee drinker. And I don't want a plastic in my mouth with the coffee, but you can do that. Or you can drink your coffee, but rinse with water right after. And then it won't set up on the teeth. The whole thing with stain is it's allowed to set up. So it's just 24 hours.
Oh, tops. And then if you rinse with water, you don't even have to get yourself too crazy.
Oh, that's fine.
It's easy.
I can do that.
And then there's all these maintenance type products. You can use these pens that have a lower level of H2O2 that takes off the extrinsic stain. But the key to get to that internal stain, those chromophores, is contact time and the concentration of that peroxide gel. And then we found out there's a way to accelerate that breakdown with warming heat and developing a mouthpiece that closes the system. So I actually, back in the day, I invented this whole world of light and heat built into a mouthpiece. So when you see those mouthpieces with light, that was on our original patents that other companies have now gone after. But that's, the whole device world of whitening. Under the professional eyes and observation is the best way to do teeth whitening because they're experienced at it. If you're doing Crest White Strips, you just should be checking in with your hygienist and your dental team.
Good to know. I will be coming in for that at some point in the future.
It's a pleasure to have you.
All right. Well, thank you so much. So much information.
A lot of dumping there.
A lot of information. I think the takeaway, though, is we got to take our oral health seriously, just as we do the rest of our health. And I often think that people dismiss their oral health, but it really, truly is a manifestation of how you're living your life. And if you want to know how you're doing, that's a great, almost like a biomarker to be assessing, is where you're at with your oral health. And there's no better place to go than Smile House, because it's beautiful. And you call it cool. I think it's sexy. Those red walls, very sexy. And it's a pleasure. Everyone on your team is such a delight. It was great to experience it firsthand. And I think more importantly than that is just the baseline. Again, going back to that, is like having that information so that whenever I do go back, I know where I was at this point in time before something bad happened. And I think that that's generally true with all data gathering. It's like you need to have a baseline so that when you start to feel unwell, exactly, you know what healthy for you looks like.
Exactly. And it's just like us wearing sensors and understanding our sleep and understanding how much fitness we're getting in. We need that feedback to be able to kind of modify our behavior. You know, what we think will drive our behavior. So like the old story, knowledge is power.
Totally. Well, thank you so much for coming on. It was such a pleasure
Great
to have
to be here, Chloe. Thank you for having me.
Thanks for tuning into this episode of Get Well Better by The Lambie. Your support truly means the world to us. Make sure to subscribe on YouTube and Spotify, or listen wherever you get your podcasts. Follow us on Instagram at The Lambie for behind the scenes content and updates. We would not be able to grow without your support and referrals. So please send this podcast to a friend, a loved one, anyone who you think is interested in learning more about health and wellness and navigating this maze of an industry.